Hi guys, I'm Dr. Hardik Ganatra. I'm a specialist plastic surgeon based in Dubai and I'm your guide to health, fitness and beauty. And today on the podcast we have a young and dynamic plastic surgeon from India, Dr. Nishant Tripathi with us. Dr. Nishant, welcome to our podcast.
Thank you so much, Dr. Hardik. It's a pleasure to be here.
So Dr. Nishant, tell us, you're here for the first time in Dubai, I believe.
Yeah, that's true.
How's your journey so far?
Oh, it's
How
been
has it
beautiful.
been?
It's been beautiful. I just finished my residency last year.
Lovely.
Yeah, thank you so much for asking. So, my main focus during my residency was all about reconstruction. We treated a lot of cancer patients, we had burn victims, we had trauma, we did that. But since my early days, I was very inclined on doing cosmetic and aesthetic surgeries. And I used to follow you on social media as well as when we used to meet in these meetings. And I used to be very fascinated by the results and the amount of work you were doing.
Thank you.
And I also wanted to learn from you that how did plastic surgery come about to you? Can you please? Yeah.
Sure. So, I probably put it on destiny. I don't know how I got into plastic surgery. I started off medicine 20 years back,
Right.
and then it was a 12-year-old, again, 12 to 13 years of journey so far. While I was doing my general surgical residency, I used to be fascinated by burns victims. I used to be fascinated by cosmetic surgery, although there was a very little exposure, but I
Right.
was very fascinated by it. And that's how I thought it would be a great idea to get into plastic surgery. As I got into plastic surgery, I realized that as plastic surgeons, we have a huge, limitless potential on creating things. So we can use tissues to create things, to move around, suck out fat, inject fat, so many introduce implants like silicone implants and other kind of fillers, hyaluronic acid. And this was all very new. So I was very fascinated by the whole creativity part of it, which
Right.
amalgamates or combines with science.
Yeah.
So science and creativity for me is aesthetic surgery, and that's what got me into cosmetic surgery.
Yeah, that's very true. I completely agree with you on that. During my journey of residency, I learned that too, that how the art and the science is combined together with the essence of patient care. It's very true about what you said. So we all know you for your body contouring work, but I know personally that you're a lot into fitness and bodybuilding as well from a very early age. So how does that translate into your work? Can you
So I
please talk a
started
little bit about?
bodybuilding
Yeah.
about 23 years back. So it's been a long journey. And of course, I started as a skinny kid who wanted to put on a lot of muscle mass. That's how I started that. That in itself gives me a lot of idea into male and female aesthetics. Because when you're building muscles, you see how your body changes, how an
True.
athletic physique looks like. And that helps me with high definition liposuctions that I do.
Right.
Also, I shifted from 20-25% body fat. I don't even know how big or fat I was, to about 10% body fat with all six packs and everything. So that also gives me an idea about how people transition from being fat to skinny and how their body shifts into it.
Right.
Also, of course, while I was bodybuilding, I used to focus a lot on nutrition because that's extremely important, right?
Right.
And high protein, less carbs, less fat, all of that. And this knowledge also translates into my consultations and follow-ups when I do it for my patients,
Right.
because they need to know about nutrition, because plastic surgery, body contouring is just one part of it. But maintaining the results is equally important, and that happens when your diet and your exercise is on point.
That's so true.
And
That's so
lastly,
true.
we as doctors, way before I was a plastic surgeon, as doctors, we study a lot of physiology. And while studying physiology, we understand the changes that a body goes through during liposuction. During these procedures, there is a lot of fluid shifts. We need to make sure that they are safe during surgical procedures, checking their blood panels, blood work, making sure they're not anemic and all of that. And that knowledge also helps in keeping the patients safe. So all in all, I would say keep the patients safe, guide them on nutrition and exercise, and use the knowledge of bodybuilding into aesthetics while transforming their physique. All of this really helped me in my body contouring journey so far.
Dr. Hardik, if you remember, in 90s and 80s, there used to be shows like Extreme Weight Loss, Biggest Loser, Fat to Fit,
Yep.
where there were patients or clients who used to subjected to extreme weight loss over 30 to 40 kgs. And a follow-up study was done a decade later and realized that they have gained all that weight that they lost over the journey.
Sure.
So what's your take on that?
So, you know what I tell people about diet and exercise? A good diet or exercise is something that you can sustain. You know, a lot of people come to us with crazy crash diets and people lose a lot of weight, just like in these television
Right.
shows. These people do not have a healthy relationship with food, because of which they gain all of this weight back. People forget that obesity is as much of a mind game as it is of the body. There is no shame in using help, like a clinical psychologist or a personal trainer, to sustain your diet and exercise.
True. Very true.
So these drugs, Ozempic, Mounjaro, Wegovy, all of these drugs are primarily used for diabetes mellitus. However, people realized that when they were also losing weight while they were on these drugs. So this side effect of weight loss led to the raging trend of these drugs, you being used for weight loss. Now, don't get me wrong. I'm all in for use of these drugs for the right reasons. There are people who have psychological issues, who are on depression. There are people who've got metabolic disorders like hypothyroidism. These patients are appropriate candidates for these drugs because they are doing it under medical supervision, and they're doing it for the right reasons. But people who just go to a pharmacy, get these drugs, and start injecting them without having studied these drugs, that's not the right way to take these drugs.
So then what is your advice on how to properly use these drugs to your advantage and to help get the right state of mind as well as body? What is your advice on that?
So, firstly, make sure that you're using these drugs for the right reason. I get a lot of patients who are 70 kgs and they have no psychological issues. They're happy in their life, but they just look at their friends who've lost a lot of weight and they feel like, hey doc, I want to look a little slimmer. Should I just be on these drugs, Mounjaro or Ozempic or something? Now, this is not the right reason to use these drugs, because these drugs are just going to help you, but they're not going to sustain this weight for you. Secondly, people who are on these drugs need to make sure that they are exercising, because exercise is going to keep the muscle mass intact and increase the muscle mass. Otherwise, they're going to lose that muscle mass because of the lost weight.
Right.
Diet is extremely important. People on Mounjaro and Ozempic only consume one meal a day, sometimes probably just 2 meals maximum. Because of this, they are low on protein intake. So they need to make sure that they're consuming enough protein in a day. Also, remember, these drugs are supposed to be taken under medical supervision. You can't just go to a pharmacy and take these drugs. Rather, get a doctor to get your blood panels done, assess your deficiencies like vitamin deficiencies, minerals, and everything else, and then put you on these drugs, monitor your weight, body composition, and then continue these drugs. Remember, these drugs are not for lifetime. They're supposed to be taken for some time till you achieve your goal weight. So, Mounjaro or Ozempic is an aid to weight loss. It's not the final destination. A good diet and exercise are irreplaceable.
That's a very right point you have placed. But what are the other side effects of these drugs?
Oh, yes, these drugs have side effects. Nausea and vomiting are commonly reported with these drugs. People take about 2 to 3 weeks to get used to these drugs because initially they have a lot of nausea. Very rarely, pancreatitis is also reported with these drugs.
But Dr. Hardik, I've always been interested in knowing how does Ozempic and Mounjaro aid in weight loss? How does these drugs work? How they change the body physiology or metabolism? Can you please share some light on
Sure.
that?
So, because these drugs were used for diabetes, they work on the glucose metabolism. So, these drugs help in reducing the glucose. That's one way. Improving glucose control always leads to some amount of fat loss and weight loss. But the other mechanism also is that these drugs suppress your appetite. So you're not as hungry. So you're probably consuming only one meal instead of 3 or 4 meals. You don't want to snack anymore because your appetite is suppressed.
Okay.
Now, because your appetite is suppressed, the body wants to use the stored energy because, hey, you need to do your normal activities, pee, poop, move around, walk around. For this purpose, the body uses the existing fat. Fat is stored energy. So the body is going to use this energy and burn this for the daily energy purpose. This is how people on these drugs happen to lose a lot of weight and a lot of fat, and they become skinny in a matter of few months.
Dr. Hardik, this topic is kind of close to me, and I wanted to ask you. I have been training for a few years, almost 5 to 6 years now, but it's very difficult to put on and maintain the muscle mass. And I've seen your journey as well. You have been training for past 14, 15 years. So can you please help me and guide me how to maintain and how to grow in size?
Sure. So I've always been a skinny kid, So you're hitting the nerve right now when you ask this question. I've been a skinny kid, and it took me many, many years as a vegetarian to put on some amount of muscle mass that I have. Firstly, people fail to understand that Indians, especially vegetarians, are always protein deficient. So you will never have enough of protein.
Okay.
So eat as much of protein as you can. 2 to 2.2 grams of per kg body weight of protein is what I recommend. Carbs are important. People want to run away from rice, bread, pasta because they say, oh, carbs is going to make me fat. But remember, carbs are important for, because that's glucose is the primary fuel to your body. So you need energy to burn in the gym. You need energy for daily living. So increase your carb intake, which will help you. Yes, you might look a little fat for the time being, but if you do, you can always burn that out using cardio, like you go on a treadmill, go swim around or something like that. People don't train to failure. That's one thing that I see people in the gym, they do not work out hard enough. They go to the gym, they're probably on their phone, they move around a bit, flirt around, but their efficiency is probably 50% in the gym. So I advise them to train to failure, and that definitely helps in building up a lot of muscle mass. And lastly, I ask them to be kind to themselves. Bodybuilding is a journey. You every time you achieve some amount of muscle mass, you want to build more. It's going to take many, many years. I've been training for 23 years and I still feel like I'm nowhere close to what my goal physique is.
That's very, very true. Patience is the key factor. I have been even, you are into bodybuilding for almost more than 20 years, but I'm still able to see your progress in past 7 to 8 years through social media. So
Absolutely.
that's a very important point you have put. Patience is the key factor. You have to be kind to yourself. You have to make sure your nutrition is right, your mindset is right. No shortcuts or no quick
Quick
fix will
fixes.
help you
Yeah,
in that,
absolutely.
because I have seen a lot of these big bulky guys in the gym, and I always used to feel that maybe I can take some help, if I, you know what I mean, through
Yeah,
some
sure.
fat gainers or through some
Fat burners,
steroids.
steroids,
Will that
hormones.
help
Yeah.
me to gain that size? So, but what do you suggest? Like, what do you mean? Is it naturally possible to attain that size? And is it even healthy to go for that kind of goal, to have that goal?
Well, naturally, you can only attain so much of muscle mass. Like I said, protein, have enough protein, train to
Right,
failure, eat your carbs, and be patient,
right.
and you're definitely going to build good muscle mass. But yes, looking at comparing ourselves with other people is not going to lead us anywhere, because
That's
people
true.
have their
That's
own
true.
journey. A lot of people practically live in the gym, and we can't afford to. We're doctors, we're plastic surgeons, we've got a lot of work to do.
Right.
So that's one thing. Don't compare yourself to other people. And secondly, all these drugs, steroids, hormones have their own set of side effects. And the question, I'm not against people who are using these drugs, but the question is, do we want to, especially as doctors, and we don't earn anything out of bodybuilding, do we actually want to subject ourselves to the risk of these drugs in our
Okay.
daily living for that amount of muscle mass? And the other thing being, even when we attain that kind of muscle mass, are you sure we're going to be happy, or we still want more muscle mass?
That's very true. Yeah. That's a thought for me. I'll think about it. Skincare is a very hot topic nowadays. We see so many facials, so many skincare routines, 7 steps, 9 steps. I have just ended my 30s and I wanted to know from you, what are you doing for yourself that you look this good?
Oh, thank you so much. But I still feel I need to work a lot on my skin. But yeah, firstly, retinol at night. Retinol is a proven inflammatory. Retinol causes some amount of mild inflammation, which actually helps in building up collagen. So I'm
Okay.
all in for retinol 1%. That's something you should never miss out. I use it every night, but I recommend people to use it twice or thrice a week.
Right.
Besides that, sunscreen, of course, extremely important for Indians as much as the Western population. Moisturizer is extremely important, especially in areas which have drier atmosphere or which are colder in temperature. Besides this, skin treatments, I go in for skin treatments like facials, like chemical peels, especially when I have shoots or events like these. I also go for micro needling and radio frequency treatments and lasers for my acne scars, which I have, and they've helped a significant bit in the last few years. Besides that, of course, you can never underestimate the importance of good diet and good nutrition and enough of hydration. You never fall short if you are doing that right.
Right. So, if I can compile your answer, it can be sun protection, moisturize, and little bit of retinol post 30s twice or thrice a week at night. Is that correct?
Absolutely, absolutely. And I would also recommend people, again, more than recommendation, I would say I get Botox done probably every 6 to 7 months.
Yeah.
And I never had those deep lines or wrinkles, but it's more of preventative treatment, which is coming
Right.
up in a big way, preventative Botox. So that's what I've
Right.
been getting done since since I got into my 30s.
Right.
So that's something I would recommend for people who are skin conscious or who are probably as vain as I am.
Right. Yeah. So this I wanted to ask from you that what is the right time to start, especially for Botox and fillers. For example, if we start with Botox, now I'm having few dynamic lines around my eye region and around my forehead. So what time did you decide, and what is the right correct time for any other individual to even seek this medical guidance?
Good question. This is very debatable. I'm sure a lot of people are going to fight me on this when I give my opinion, but
Right.
I feel like when you have the right knowledge
Right.
of what Botox is, including the side effects.
Right.
Secondly, when you have the right practitioner available to you, because you hear people getting Botox done, you can't go to anyone who probably like let's say a general practitioner or probably someone who doesn't know how to inject Botox. Don't go. So make sure you go to the right person.
Right.
So right time would depend on the right person, on the right knowledge that you have, and also whether you can afford it. Remember, these treatments are luxury. No one dies out of not getting Botox done,
Right.
right? It's not a brain tumor or a hernia, right?
Right.
So when you can afford it, I would say go in for it. But yes, I would say fourth point is probably the most important point, which is when you are in a good psychological state. Now, when younger people, let's say were 16-year-olds or 18-year-olds, these people are not in the right frame of mind to get these treatments done.
Right.
For these people, because they are going to compare with other people, and they're not never going to stop, because they start with Botox and then fillers and then hair transplant and then other surgeries. And where does this stop? And remember, these people are probably not even making any money, so they're using their parents' money and
True.
throwing it up in trying to look as good, and they will never look good enough.
True.
So when someone is in a right psychological state of mind, when people can afford it by themselves, and when they have the right practitioner to do it for them, go for it. I'm all in for Botox.
That's very true. If you ask me, that point you said about choosing the right practitioner, that is so important. Having the right and qualified person who is, because it's your face, you are allowing somebody to touch, to treat. You want somebody who has the enough information and knowledge who can assess you correctly and then give you the right advice, whether it is required for you or not.
Yeah, so learning when to say no is very important for
Very
us as
true.
practitioners,
Yeah.
rather than just saying yes to
Yeah.
make some money.
Very true, very true. Dr. Hardik, do you have older patients chasing youth, asking you to make me look like 25, make me go back in time? And how do you assess and how do you approach these patients?
So, firstly, I tell these patients that you can never beat aging. Aging is inevitable.
Right.
I get a lot of treatments done myself, but I know for a fact that aging is inevitable. I'm not as young as you are, and I can never be.
Right.
That's just the law of nature, right? But you can always fight aging. So you can't beat aging, but you can fight aging. And fighting aging is with the treatments that I mentioned, which is Botox, fillers, skincare, and all of those treatments. Having realistic expectations is extremely important, because you could have a lot of money and come to me to look 20 years younger, but that's just not going to happen, because money cannot solve everything.
Right. That's a great point you have put.
So, on that note, we'd like to conclude our podcast. Thank you so much, Dr. Nishant, for coming over as a guest. And
Thank you so much, Dr. Hardik, for having me. And definitely will be seeing you very, very soon.
see you in Dubai again.
Thank you. Thank you.